So far we have done uh, some important sections of a macroscopic urine examination. We've done the appearance, stability, pH, specific gravity, and we've also touched on proteinuria as to when proteinuria is significant and when it's not. And now I'll be talking about blood, that is hematuria, and how to interpret and how to take it forward, and how what is the correlation between hematuria and all of the other variables with on the macroscopic side of urine examination. Presence of blood in the urine is called hematuria. And hematuria can be macroscopic, it can be microscopic hematuria. Often it is microscopic. Macroscopic basically means that there is quite a lot of blood in the urine. But this has to be confirmed because not all red urines are because of blood. And so, therefore, whenever you get blood in the urine, this must also always be confirmed with the presence of RBCs. But coming to blood, which means hematuria, and hematuria can be from different sources. It can be from a pre-renal source or a renal or a post-renal source. Um, and when you get the report, just like proteins, you'll get the report as trace, and then you'll get the report as +1, +2, +3, and sometimes you can get that as +4 as well. But these pluses 1, 2, and 3 are not as significant as the pluses of the protein side. So therefore, if you've got 1 plus or 2 plus or 3 plus proteins, they more or less mean exactly the same thing as you would get like any kind of hematuria, but they're not equivalent to this. So you can't put a value, you can't put a number to these pluses. They just mean the amount. So if it's +3, obviously it means that the blood is in large amount, and this has to be confirmed with the RBCs. Trace of blood can be ignored in women, especially because it can be because of soiling from menstruation. The presence of 1 plus blood and more in a male is significant. We need to find out the cause. The presence of 1 plus blood in a female, once again, can be ignored, but the presence of 2 or 3 pluses of blood, they need further evaluation. But there is a catch. In a female, a menstruating female, it's important to know when to take the urine sample. Say, for example, if the first day of the start of periods is the first of the month, and we say that the cycle lasts for 5 days. So the cycle lasts for 5 days, and the first of the month is when the cycle starts. You should not take a sample 5 days prior to that. So, in other words, from the 25th of the previous month onwards till the expected date of start of periods, you should not take the urine sample because it's more than likely to be a soiled urine sample. And likewise, from the end of the periods, like if it's day 5 in a regular cycle, wait for another 7 days before you take a urine sample. So in other words, these become 12 days and this is 5 days. So these 17 days are the ones in which you will not take a urine sample because it will be soiled. If you want to take a urine sample, take the urine sample from the 12th onwards till the 25th, and this is going to give you a more accurate report as compared to if you take them on these days. So you can ignore if a urine sample is taken on these days. And likewise, if somebody is catheterized and and you get a urine report, it can be ignored because it will undoubtedly show blood in the urine. But blood in the urine means hematuria, and as I've said, it can be because of three causes. It can be pre-renal. So it can be pre-renal, renal, and it can be post-renal. If it's pre-renal, always take a history whether they're on aspirin, they're on clopidogrel, or any of the other blood-thinning medications. So always take a history whether they've got a bleeding disorder or not. If it's renal, could likely to be because of a kidney stone or a urine infection, and if it's painless, then it can be because of malignancy. If it's post-renal, it can be in males, it can be prostatic coming from the bladder, or it could be urethral, in fact. And if it's a female, then once again it could be coming from a stone in the bladder or a stone in the ureters, or it could be coming from urethritis. In women who've got menorrhagia and they've got intermittent bleeding from their periods, it'll be very difficult to get a urine sample which may not be soiled. Therefore, this is an important part of history which has to be ensured. Now, if it's blood in the urine, you would obviously want to know whether or not there is infection or not, and that's where these two variables come in. That is nitrate and leukocyte esterase. And so therefore, if the nitrate is positive, nitrate is basically when nitrate is converted to nitrite by the action of bacteria. So if the nitrate is positive and the leukocyte esterase is positive, along with blood, then this is more likely to be a urinary tract infection. If there is just blood in the urine, nitrate and leukocyte esterase are not positive, then it may not signify urine infection. So that's number one. The second thing, important one, is the correlation between blood and protein in the urine. The presence of blood plus 2 plus protein plus 2 could be because of a glomerular disease. But the presence of blood plus 3 with protein of plus 1 is not significant, because plus 1 of protein can be because of the presence of blood. We know protein is a normal variant of blood. So if there's large amount of blood coming, you're bound to get proteins as well. So this does not mean that the person has got a urinary tract infection. The person has got a glomerular disease. They can have a urinary tract infection. They can have another cause, but this does not signify the presence of a glomerular disease. And this is what obviously we want to see when we look at these tests. But the presence of protein plus 4 and the presence of blood plus 4 virtually almost always mean that it is coming from the kidneys. And if that is the case, then this person needs further investigation. Very likely there may be an element of glomerular disease. So in summary, if you've got blood in the urine, 1 plus 2 plus 3, and this is just isolated blood in the urine, then this could be any cause from pre-renal, renal to post-renal cause. If you've got blood in the urine along with protein in the urine, that means hemoproteinuria. See whether or not they fall into equation. So if there is 3 pluses of blood, just 1 plus of protein, this is primarily hematuria. Find out the cause for hematuria, may not be a glomerular disease. If it's both of them are plus 2 and plus 2, this could be because of a glomerular disease, but once again it could be a urine infection or the cause. And if it is plus 4, more than likely that this person has got a glomerular disease, needs further investigation, perhaps a kidney biopsy as well. Thank you.